Good morning, everybody. My name is Lynn Ray, as Noah said. So we're going to talk a little bit today about the spiration valve system, which is an endobronchial treatment for severe emphysema. This is a customized, minimally invasive treatment option for lung volume reduction, which has been proven to reduce hyperinflation. It improves lung function and also offers patient a better quality of life. Patients with emphysema struggle day to day with commonly formed activities like most of us would be very familiar with: housework, grocery shopping, just very, very simple activities. So they struggle with this. And today I have Lucie with me, and Lucie participated in our clinical trial, and she received the spiration valve system. And as she described, she's been given a second chance of life. So good morning, Lucie. Thank you for being with us today.
Thank you, Lynn.
So I have a couple of questions for you, Lucie, in your own words, and just take your time here. So just first of all, tell us how your story began.
Well, before I was diagnosed with emphysema, we were a very active couple. We would go dancing, we'd go swimming, we'd do cookout. We would have the family over, and we always would have a family reunion, and we were quite a few people there. And little by little, my lungs start feeling heavy, and I wasn't breathing as good as I thought I should be. And the more it would go, the worse I was getting. And even though I was diagnosed with emphysema, I was a heavy smoker.
Okay.
And we were smoking the Canadian cigarette, which are stronger. So I was getting to a point where I cannot do my daily activity. I would try just to walk from here to the table. I would have to stop and catch my breath because I couldn't do it anymore. So I could feel my lungs full of smoke. It's just as if I could taste it inside. And I did, like Nick was saying before, I lost 25 pounds at least. And I just couldn't breathe. I couldn't do what we used to do before. There was no quality of life anymore.
Lucie, that sounds awful, but you said you were a smoker, but I also understand you were diagnosed with the alpha-1 antitrypsin deficiencies as well, correct?
Yes.
So in your words, can you explain that to us?
Well, alpha-1 antitrypsin is genetic. So I lack the protein in my blood to protect my lungs. So without the protection, I'm more subject to get cold or lung infection or whatever. And the deficiency of alpha the deficiency of alpha causes the emphysema. And even a person that has never smoked a cigarette in their life could get emphysema. And thank God the valve was approved to help people like us breathe better.
That's wonderful.
Yes, it is.
So how did you actually learn about the procedure?
Well, being an alpha-1, my husband and we would go to the national conference once a year. And over there, you learn about all kinds of, you see other alpha that are like you and their spouse and their caregiver. And one of my best friends, she said, I want you to meet a lady that was part of this research. It's the Improve clinical research. And she says, I'll let her tell you the story. So we met this girl, and she started talking about the spiration valve system. And she was like me. She wasn't as bad as I was, but she says, I did some research, and she said, I found out that it was just overnight in the hospital, but you got to qualify. They do all kinds of tests, and you got to qualify for the spiration valve.
Yeah.
So, and she says it did such a difference in my life. She says I would I would tell everybody that needs it that they should have it.
Right.
So when we get back home, I call the Hershey Clinical Research, our medical center, and I spoke to the patient coordinator, and they started my evaluation. So it takes quite a few times to go back and forth for testing and things like that. And when I finally got, I'm sorry.
No, it's okay. Take your time, Lucie, in your words.
When I finally got the call that I did qualify, we set up the date, and I had the procedure. The next morning, when they came and said, okay, everything is fine, you can go home. But they wanted us to stay there 3-4 days because that was about 250 miles from our home.
Yeah, yeah.
So we didn't know anybody in Hershey, so we decided to go to the mall.
Okay.
I still could go shopping slowly, you know. So we went there walking little by little. We do a little bit. My husband said, you know, if you can't make it, I'll go get the car and come and get you, and you'll be all right. So you're always skeptical. Am I really that, you know, can I really walk the whole mall?
Yeah.
So every step that I would take, oh, I can do it. Thank God I can do it.
Wow.
If it wasn't for the valve, I wouldn't be able to do it. So I really got a second chance to life.
Lucie, that's really, really heartwarming.
Oh,
So
it's nice. It's great. It's super.
the procedure itself that you mentioned, can you just explain that a little bit for us?
Well, the procedure is done during bronchoscopy, and they place the valve in specific airways to redirect the air from the diseased part of your lungs to the healthier part of your lungs.
Okay.
And it helps you breathe much better.
Yeah.
Because I went from, I was sure that it was the end, to I could walk, there's so many things that I could do now that I couldn't do before.
Right. So you mentioned the days following the procedure itself. What about the following weeks? How were you feeling then?
I was grateful. I was so impressed with everything that I could do. And at first you think, well, maybe it's for there, but the more you went, the better it was getting.
Yeah.
And it's easy to think of that you can do a certain things, but to really go and do it is something else.
Yeah.
You take everything for granted, but we shouldn't, because every little thing, just cooking, just anything, you can't do it if you can't breathe.
Right. So you described your life before emphysema started.
Right.
And you've explained a little bit about afterwards. What would you say, in your words, was the biggest change in your life after having this procedure?
Well, we're back to dancing. We're back to doing activities. We're really, we visit with our family, and we're back with doing things with the friends. We go out to dinner. And the most important thing in the life is the family.
Absolutely.
And we have 2 great grandkids that we can enjoy. We can see our family grow. I can pick them up. I can babysit them. Life is beautiful, and it is my second chance to life.
So it sounds like that's probably the biggest thing that you feel you would have missed if you hadn't have had the procedure.
Oh, yes,
Absolutely.
yes, it sure really.
Yeah. So, would you encourage other patients to get this procedure?
Yes, and I did from the start. We would go. Let's say I would go shopping for grocery or things like that. I would see somebody with oxygen. So I'd go to them and I'd say, could I speak to you for a few minutes? And she said, well, sure. And I would tell them I was on oxygen before and I couldn't hardly do anything. And it's hard for a person to accept to carry your oxygen in front of everybody.
Yeah.
And I start explaining to them how I was and what the difference that the aspiration valve did for me. And it was all thanks to Olympus that worked so hard at getting the valve approved. So now anybody can go to their doctor, and a lot of doctors don't know about it, and just ask them to look into it, because it's really something that can give you your life back.
Well, Lucie, thank you very much for joining us today, and we wish you the best of good health in the future. Thank you.
Okay, thank you very much, and thank you to Olympus again.
Thank you.